step from taking Arkansas from being the 49th healthiest state to a more healthy state. We're going to begin with a policy panel, and thankfully I am joined here with Senator Penzo, Representative Holladay, Candidate Bo Renshaw, Representative Brown, and Representative Pilkington. So thank you all for being here. Let's start with talking about the demographic that was here first, and that would be our older more senior citizens in the state. By 2030, approximately a quarter of our state is supposed to be above the age of 60. That would be about a 72% increase from 2000 to 2030. So that is a quickly changing demographic for our state. So Representative Holladay, I've seen you talk about our senior citizens at the Capitol and talking about them aging limitation. So from a wellness angle, what does that mean to you?
Thank you very much. Thank you all for being here. Can everybody hear me? Not in the back? All right, I'll try. So when I think about wellness for our seniors, I really think about their mental health. I think about three aspects when we're dealing with our seniors. And I hope everyone can hear that stat again. By 2030, a quarter of Arkansas's population is going to be over 60 years old. In my district, it's going to be over 65, and it's closer to 30%. We are not ready for that age population based on where we are currently with our state, with our legislature, and with a whole horde of our policies. So when I think about their mental health, I think about socialization. I think about getting those folks to senior centers, and I think how important that is for their mental health. Getting them out of their homes and around other seniors or even young folks that want to take part in our senior citizens' everyday lives, right? That's an important piece. Let's get them out there. Let's get them to our senior centers across the great state of Arkansas. The second thing I think about is they need to be fed. Now, across the state of Arkansas, that is a major issue that we have. In my district, I know we have, Tyler here mentioned Caroline. They do a fantastic job with our Meals on Wheels programs, but their funding is in jeopardy. It was almost cut just this year, just a few months ago. So we need to get our folks fed, because a lot of those seniors in my community especially aren't able to go and grocery shop because they don't have the transportation to get there. They don't have the ability to cook their own meals, right? That's two pieces. The last piece is simply taking care of the folks that were in front of us, right? We want them to socialize, we want them to get the transportation. And the last thing, we need to keep them healthy, so we want to get them to the doctor, and it all goes back for me to the transportation. And allowing folks like Caroline, increasing their funding and allowing them to get those folks where they need.
Thank you. And a big part of increasing the state's life expectancy, which is one of those metrics that goes into our health rating nationally, is ensuring that those in our community that are 60 and above are remaining healthy, happy, and have access to the necessities that they need. So what are some of the policy gaps that you think are appropriate to address senior care?
I kind of touched on that briefly, but we'll find a spot with the mic that works. So when we think about folks like CareLink or other senior centers, different areas across the state of Arkansas, that funding line has not been increased in 17 years. So we have kept the line item in our budget flat with our senior centers, with our Meals on Wheels program, with our transportation budgets. As everyone in this room knows, gas prices have gone up, so we haven't adjusted for that. We also haven't adjusted for inflation. That's an area that going to be a piece of legislation that I will definitely work on as we head towards January. We're already working on it, how I can get an appropriation for something like that. The other piece that I really want to touch on is caregiver tax credits. As someone whose father is currently on long-term hospice, us figuring out that process was difficult enough. So the last piece would be healthcare access, ease of access. Make it easy for our folks to navigate the system, however that looks, whether that's legislation, whether that's a better part of us here at the state, to let folks know how to navigate the process. Those are really the three areas I think of. So increased funding for Meals on Wheels, for our transportation needs, for our senior centers, caregiver tax credit, which I'm very big on already right now, and then obviously last part. So.
Awesome, thank you very much. All right, and so we're going to go from the seniors to talking a little bit about the younger demographic. Younger adults have have a little bit less physical ailments and some more mental struggles these days. So Representative Brown, what are some of the programs and things that exist already in our state that we can get younger people to engage with to potentially help their mental health?
Well, it's great to be here with everyone. I'm going to take a little bit different of an angle on this and also plug part of my district. I represent District 41, which is Cleburne and Stone County, and we are known for having beautiful natural resources. And part of the reason why I love a group like this that looks at the whole health of a person, that conversation matters so much because we know so many people who are struggling, and especially young adults, with mental illness and depression, things like that, is sometimes because we're locked away with this. I am 28 years old and I have had an iPhone since I was 14, and so one place that we're kind of looking to lead young adults in Arkansas to is to getting outside and getting active. And obviously it's not a one size fit for everyone, but that's something that we can do here in the natural state, and we can encourage our young adults to utilize what we have in the state, our beautiful resources, to get active, to be proactive, and then I know we're going to talk a little bit more about some of the policies that have worked for the women, but that would be a response I'd give you, Tyler, there.
But unfortunately, too many people about our age are beginning to try to start their family and are having some potential fertility issues and things like that. So can you tell us a bit about the Restore Act that you helped pass and the potential impact that can have on Arkansas families, pregnancies, and newborns?
Yeah, so the Restore Act is actually the first legislation I filed in my first session here in 2025. And what it does is it gives restorative reproductive medicine coverage for women who may be struggling with infertility. It doesn't take away from some of the other industries and coverage that we offer, but it adds another option. And so right now in Gen Z and millennial women, we are seeing higher rates of infertility. But not only if a woman is able to conceive, but if she is already struggling with endometriosis or PCOS or hormonal imbalances that affect her quality of life, even if she does conceive, she really needs care in these ways. And so it's something that I've personally witnessed in my generation. And so I introduced this bill to give restorative reproductive medicine coverage that has a more of a holistic approach to looking at the whole woman's body. And so in that legislation, we even added, simple language like a hormonal panel, a blood panel, exploratory surgery for endometriosis. With Gen Z and millennial women, we are seeing more and more get diagnosed with these reproductive health conditions. And it's important, for me, I felt the importance as the group of the first Gen Z elected to the House, but then also the youngest woman elected to the House, to introduce legislation for those women. And each time I've shared about it and I've heard from Arkansans, it crosses political lines. It crosses demographic lines. So many young women are struggling in this area. And this was one thing that we could do. I'm not saying it is the fix-all and be-all. It was one step. We're actually still writing the rules on it and how it's going to be implemented. And there's a good chance I come back and add more to it this next session. But it was a win for Arkansas, and I actually know of 4 other states right now that are introducing very similar to this bill in their state Restore Act. And some of them have called me and they said, Alyssa, you have to come testify though, because I'm an older man and I don't want to talk about all this and I'm not for sure. So I'm honored that Arkansas has led a little bit in this area. And if anyone in this room has, feedback in that or wants to do some more research, I'd love to be a resource in it, because it's something that is important and we must address now for this next generation.
Thank you, Representative Brown. Representative Pilkington, you also are an advocate in the maternal health space. Could you talk to us a little bit about some of the maternal health policies that you're trying to pass?
Sure, thank you. As a lot of y'all know, I was the lead sponsor of Healthy Moms, Healthy Babies, which was a push to try to improve us in maternal health. I'm sure you guys are all aware we're the last in the nation. And so one of the things that I really liked about that was we really looked at a lot of, not just one aspect of it, we looked at everything. So whether it's expansion of telehealth, allowing for, doulas to do more, allowing midwives to do more, all, getting more, I guess, players in the game is a good way I like to think about it. I think that's been really helpful. And of course, presumptive eligibility for these women so that they can get in and get seen so that we can address the issues, when it's prenatal as opposed to postpartum, because it's, we can, early intervention is always better at producing better results. So, that's one of the, I'm very proud of that legislation. It's kind of the same as the Restore Act. We're still getting a lot of the rules and a lot of the technical parts out of there. So I think this next session I'll probably be dealing with some of those things, tweaking things like that to make it even better. But of course I'll also, I've been an advocate for doing 12-month expansion for postpartum Medicaid. CMS denying our waiver for our homes, what comes next for Arkansas's Medicaid population is a little bit up in the air right now. And so as we're having those discussions, I've been very vocal in the room about, we have this gap that's not getting seen that the 49 other states from Ruby Red, Florida to, navy blue, California have passed this. And so I think it's a necessary part, and as some of those things change in our Medicaid population, we just need to make sure these women don't get left behind. But to me, I think it's just an important thing to do. I mean, you heard the demographics on age. I mean, we're not having enough kids in this state. Talk to any superintendent, they'll tell you the delta between their 9th grade class and their kindergarten class is about 14%. And it's not because they're going to school or going to private schools, because they're not there. And so when we think about our workforce, when we think about Social Security, when we think about everything that we need the next generation to work and put in to build our economy, there's a real big bubble that's about to burst with our population. So it's one of those deals where it started out, I was just really interested in maternal health, but it's kind of expanded because we really see we have a demographic problem that's heading our way really fast. If we're not proactive in doing things to improve the health of women, I think we will find ourselves on the wrong end of that equation. So.
Thank you. And I know that you are in your professional career, you are a healthcare provider and been an advocate in this space for a while. So could you tell us a little bit about finding that balance between balancing the interests of healthcare providers and the citizens of our state as consumers of healthcare services?
Sure. And I'll correct you, I'm a healthcare administrator, so I'm way less liked than a provider. I'm the bad guy in the room. And my father and grandfather were both hospital administrators here in the state, so it's just in the blood. But no, I think there is a balancing act. I mean, I tell people all the time, healthcare is an ecosystem. I mean, it all works together. I mean, you may hate insurance companies, but they're a necessary evil, and you get frustrated with pharmacies, but maybe the issue that you have them is actually because the manufacturer, not that there's just all these nuances. And you guys know this. I mean, I'm preaching to the choir on this. But, and I try to reiterate that to my colleagues that we do talk about policy. It's really easy to look at one group or one provider and say, well, they're the problem, or we need to do this to fix it, not understanding that this is a giant ecosystem. And one of the things that I've always been an advocate for is getting more people in the game and allowing providers to do more, to practice more to their ability. Because we don't have enough providers in the state. So I guess the question was, how do I balance the interests of healthcare providers and our citizens? I mean, I think for us, it's making sure that we're responsible in the regulations we do to make sure that we are protecting our citizens from bad actors, but at the same time, we're allowing our providers to practice. And then, of course, on the financial side, we want people, we want commercial insurance to pay more. We want them to get paid more, but of course, when we have to increase our Medicaid spend because commercial payers aren't paying what they should, that of course comes out on our end as a taxpayer. So there's a balancing act there. I mean, anytime we change anything really with insurance providers, then you'll hear, that's the reason your premiums increase. And so, is it worth a premium increase to cover certain things? That's a decision we have to make every single legislative session. Now, granted, sometimes we get blamed for premium increases that are not our fault, and I will definitely take that up with anyone who's representing the insurance companies here. But that is a balancing act. I mean, we have to do a balanced budget. We have a balanced budget amendment here in Arkansas, so we can't deficit spend. And so every time we pay for something on the healthcare side, it means there's something else we can't spend money on. So we're constantly making those value equations in our head. But I think, and I'm just kind of rambling words out, so sorry about this. It's just I could go on this for a whole time, but I really just do think, your legislature does care about the health parks. So we know it's bad. We know we're at the bottom, but we're trying to find a way that we do it that we don't bankrupt ourselves in the process, and then it really serves nobody. And so, but as I think we had a lot of good discussions last session, especially on the commercial reimbursement. And so I think because of that, and because of some of the bills that didn't pass but got pretty far along the line, it's actually put us in a better position, I think, when it comes to trying to get higher commercial rate reimbursement from some of these insurance companies. And so I think that's a little bit of what we need to do, is just constantly be pushing them and saying, we're going to hold you accountable. It's crazy to think that you can do, an MRI in Mississippi and do one just over the state line in Arkansas, and yet they'll get paid $400 more than us. So there's nothing different. So what's the deal? So anyways, I think that's that balancing act is, we've got to be good stewards, but also I think even on that, I think we can also be good advocates for our people, some of these big companies, because a lot of times, if you're a small rural hospital, how do you're in a bad negotiating position with a large health insurer. And so, I think just kind of find a way to sometimes be their champions and be the champions for those people. I think that's something we can do, and so I think that's a way to kind of balance it. I will say I'll be here around for a little more, but I do have to leave and pick my son from school, and I don't live here. I live in the River Valley, so if you just see me chat out, it's not because someone said something that offended me. I just say.
All right, Mr. Renshaw. In your professional career, I would imagine that you typically see a lot of people after something has gone wrong with their health. So how has this impacted your perspective on preventative care with things such as screenings, early intervention, and overall general wellness programs?
So I've definitely seen some injuries, including Mr. Tyler. He was one of my patients at one time. I don't think I violated him. He's right here. He's okay with it. So I'm right here in the district. I've built my career here 28 years as a physical therapist and athletic trainer, and take care of a lot of high schools. And so we've been on the forefront, and so it's been really interesting to kind of see, wellness is near and dear to my heart. So I grew up in athletics. My mother said, "You're not sitting at home. You're going to run track this summer." I said, "I'm doing what? I'm not very good at it." My sister was great, track scholarship. My brother was a great athlete, and then here came Bo. But it instituted wellness in me. And so went on to play football in college, and from there built a career on health and wellness. So I preach health and wellness every single day to my patients, and I've been in those rooms and talked to them about preventative care and what do we got to do to make sure you're not coming back to see me, and that's okay. And so we're on the forefront of these talks. We're talking with our patients. We're listening to what's going on to them. We like to say in the physical therapy business, mobility and strength are the keys. So motion is lotion is what we like to get people to remember, because we feel like you get up and move, you're going to be active. And these are the kind of things that we've got to be able to emphasize on all fronts, not just mine as a physical therapy, but as a community. Having programs out there, exercise programs, bike paths, running paths. What are we doing from 5K runs? What are we doing from family exercise focused activities that we're doing in each community? Not only are where we ranked nationwide, but where are we ranked in our communities in our state? Are we looking at that? What can we do from community to community? It's completely different, right? All across our state. And a lot of you guys are involved in that already, where you're at. And so I would say keep up that fight, keep up the preventative medicine and everything you're doing.
All right, thank you. And so what do you think state and local governments can do to encourage healthier lifestyles, exercises, and more active communities?
Yeah, so a lot of physical therapists, we tease the students who want to go into physical therapy, because you always ask them, why do you want to be a physical therapist? And they say, because I want to help people. Well, probably everybody in this room could say that. And so we tease like that, but that's really true. We want to help people. And so how do we help people? It's not just physically on my part, but it's also how do we help them get back to doing whatever they want to do and do it in an affordable way. So when it comes to that, it's policy. And that's a piece of that. It's kind of the branch. You were talking about the ecosystem. Well, part of that branch is the policy side of this. So for physical therapists, I've been on the forefront the last 20 years doing this kind of stuff. And so we've been able to recently expand the coverage for over 21 Medicaid population to have rehab services closer to home. Why? Because we listened to our patients and said, okay, I'm going down to rural Arkansas and I'm going to have post-surgical care, and it's 45 minutes to the nearest hospital, and that's the only rehab service I can get. Guys, what are we doing? They're not going to receive the services. So what do we got to do? We got to be able to expand Medicaid. Now, the cool thing about this as Arkansans is when we actually expand Medicaid, we improve their outcomes, because they're actually going to get the services they need. This lowers the healthcare spend and the tax dollars spent. This is where we got to get. We got to get smarter with how we're doing things. We got to look at things individually in the situation we're dealing with. And for me, it's rehab services. How do we get to a point where they're getting the access to care that they need? And then guess what? We get to lower surgeries in the future. We get to decrease the need for MRIs and not even have to have that spend. And outcomes are better. So we love seeing that kind of thing. So policy is a big one. I think we've done other things on prior authorization and other things that are big fight things. And I've seen a lot of movement now.
Thank you, Mr. Renshaw. All right, Senator Penzo, during your time in office, you've supported expanding services that are covered by insurance and otherwise pushing back on excessive insurance interference to ensure that care decision-making remains between patients and doctors. Why is it critical for patients to have flexibility and autonomy?
I think that a lot of times the insurance companies, like I've got a background similar to Mr. Renshaw's here in physical therapy, and I worked in a rehab facility with stroke patients. And a lot of times I would see patients come in and they were discharged before the physical therapist that was working with them thought they should be discharged. Well, it becomes a revolving door. They're back in, they have a fall, they weren't ready to be discharged, they were sent home prematurely. And a lot of times I think that increases the costs overall in the system, whether it's the insurance company or the state that's covering that. And it's also poor quality of care for the patients. So I think that a lot of times the insurance needs to, providers in the state, barriers that are in place need to be removed so the patient and their doctor can, or their caregiver in general, whether it's a physical therapist or whatever, can make that decision. We see it a lot with my mom had cancer. My sister's boyfriend currently is fighting cancer. You have to try this drug. It has to fail, it has to fail, it has to fail before you can go for the big gun that, with CAR T therapy that's coming out. That's some legislation I'm going to be looking into for January. Arguably is a cure. If you don't know what CAR T is, they train up your killer T cells to go out and attack the specific cancer. There'll be a marker on that cancer cell. They train your killer T's to go find that cancer and kill it. So a lot of times we'll spend money and possibly lose the patient or debilitate them so bad with chemo and radiation that they have a hard time even with the CAR T. If we started that earlier, it's better patient care, and in the long run, I think we'll save lives, we'll save money, and the system will be stronger, and Arkansas will be stronger. Those are just two examples that kind of pop into my head when I think about this, but we need the decisions need to be more between the patient and the healthcare provider.
Do you also think that ensuring that there are a wider variety of services, do you think that's part of the solution of making the state healthier?
Absolutely. I think that, my goals in creating healthcare policy are to increase access to care, lower healthcare costs, and make sure patients have choices. You know, creating choices, you know, in Arkansas, like I had a naturopathic physician that I thought it was interesting. We had a naturopath come up, and I'd love to check with you after a while. We came real close getting that passed. That's something I've worked on every year. Not that there's any issue with DOs or MDs, but I prefer, I had a naturopathic physician that changed my life. Had a lot of healthcare issues that the MDs, I saw 3 people that were MDs and they couldn't figure it out. I had a friend that was a naturopath and she pretty much told me what was wrong over the phone. I won't use the word diagnose because they can't practice in Arkansas. But came in and she said, let's do some blood work, we'll get this figured out. She couldn't even do blood work. She was working under a chiropractor. So it's a messed up system, but we need to allow more choices. One of the biggest solutions, I think, is increasing the scope of practice for the existing healthcare providers in Arkansas. Yeah. So there's a lot of, I mean, even every healthcare provider is trained to a higher level than they're allowed to practice in the state.
Yes.
I can't think of anybody. So the majority of the legislation I've worked on over the years has been to increase, whether it's for APRNs, nurse, anesthetist, that was a big dog fight. And then, of course, getting naturopathic physicians licensed, I think, will be a huge attribute to the state. So.
Awesome, thank you. And then you have a little bit more relaxing fall coming up than the rest of the people on this panel because you have no opposition to your seat in 2026. And you also happen to serve on the Public Health Committee currently. So you've got a front row seat to some of the health issues and policies that are coming down the pipe this upcoming legislative session. So could you just spend a few minutes telling us of some of the things that we have to look forward to in this next legislative session?
So there's a lot of things going to be coming up, but I probably shouldn't talk about all of them yet because there's a lot of details being worked through. But I will tell you that some of the legislation that I'm going to continue working on, I don't know what the feel in this room is for fluoride in our water supply, but currently Arkansas has a mandate that fluoride has to be put in our drinking water. I had a bill the last legislative session, got out of the Senate. It's the most movement it's ever had. There's been attempts over the years to do it. Then leave it up to the municipalities, the water providers, whether or not puts it back in the control of the local communities. Fluoride is it's a neurotoxin, or you can classify it as a drug. Either way, it needs to be dosed if it's a drug. If it's a neurotoxin, it doesn't need to be in the water. So whichever argument it is, it needs to be left up to the communities. We're going to push forward with the naturopathic physician bill. I've got a lot of adoption legislation that involves health care. I had some issues. We just adopted a little girl that was born in December, and there were some arguments whether or not the foster parents at the time had decision-making authority for the child's medical treatment, even though the mother had relinquished her parental rights and given us the opportunity. Even though we were in agreement, there's a gray area that needs to be clarified. So those are some of the big things. Transparency. When it comes to this is something I'm looking at. There's a cash price for your drugs. Nobody knows that the cash price is probably cheaper than your copay. There's like gag orders in place between the PBMs and the pharmacists. So you may come in and pay a $20 copay and your cash out of pocket price might be $5. And that happens every day. I've worked a lot on PBM legislation over the last 2 years. So my biggest goal is to put the patient first and surround them with the healthcare providers they need to get the care they need, especially in rural Arkansas where we have limitations. Here's another example. My sister is a quadriplegic. There's not enough nurses to take care of her, and there's this push to push her into a nursing home where the cost of care is arguably way higher than if she's taken care of at home. So one of my big goals is to get the lowest qualified person at the cheapest price to keep people in their homes, and where they're not going into a nursing home where it's costing the state more money, their quality of life is degraded, and leave them at home where they're happy with their pets and their comfortable surroundings. Don't force people into nursing homes. There's time for that down the road when they degrade, they can't be taken care of at home, but those are just some of the things I'm working on.
All right, thank you. And so we're just going to go down the line from this point with one final question. What can we as citizens and organizations in this state do to help support legislative efforts to positively affect health and wellness?
Yeah, I think that's a great question. So we hear it all the time, and they want to be helpful, they don't know how, so I love the question. What I would do is just kind of inform us, or help inform us of things that we're not doing that we should be doing, and lay out, how much it's going to cost or how much it's going to save the state. I mean, those are all the questions we're going to get pushed back on. And so I think what's I always found really interesting, and Senator Penzo kind of mentioned it too. I mean, if you've got something and you show that it actually will be savings to the patient or savings to the state, I mean, that gives us the fuel to do it. I mean, so many times people come in and say, well, we do this, so it'll just create a better outcome. And it's like, well, there's a price tag for that. We're trying to balance all these things. Help us find the path there. Can we find the savings? And a lot of times there are savings, especially when you do preventive care. Mr. Renshaw said the same thing. I mean, if we're able to treat people, do early intervention, it pays dividends down the road. And so I think sometimes coming and informing us of those things and then bringing the numbers and the data to back that up, data is king. I tell people that all the time. It's really hard to argue with that. And so I just think, letting us inform of policies we need to be doing and thinking about, because even though, we try to be on top of our game with what's going on, there's a lot of things that it's so vast and so big, we miss things all the time. And so sometimes we just literally, we're like a dog with a tennis ball, like, hey, look here, focus for 5 seconds here. You can do this and improve the lives of our Kansans. That's helpful to us. And so I just hope, when you do come and talk to us more, bring your ideas, not just your problems. That's a big thing. I mean, I do that in my professional life as well. If someone comes to me, they've got an issue, it's like, well, what is your solution to this first? And that's always helpful. That's helpful for us because, trust me, we hear problems nonstop. And so it's sometimes nice to at least give us at least a solution for us to chew on. And then once again, like I said, always bring the data, because that's going to be the question that we get peppered the most is, well, how much is it going to cost the state? How does this affect everybody else? And man, nothing can sell good healthcare policy like showing that it's actually going to improve lives, but at the same time, lower our overall healthcare spend. So that's what I would say. And now I got to go. Bye.
Well, those are great points. I'll give a different side to this. I would say don't be afraid to show up and don't wait for an invitation to show up. The Capitol is the people's house. It's not just for the representatives. It's not just for the associations. It's not just for the lobbyists. Senator Penzo, like mentioned, some really good bills. I hope to champion some of them in the House with him. But if those are bills that you say, yeah, I agree with that, come testify on them. Let your voice be heard. Yes, you have a constitutional republic and we have representatives that are representing you in the Capitol, but they may not be there to share your perspective. And so don't be intimidated by that. And I feel like I can speak on this because in 2023, I actually was an advocate at the Capitol. And so I went from being in the gallery during the 2023 session to on the House floor in the 2025 session. And so I've seen both sides of this, and your voices matter there, and it's important that you bring your perspective. And so again, don't wait for an invitation. Each one of us see the schedule online just the same. I'll have people from my district like, let me know when this bill is on the schedule, and I'm like, I see it at the same time you do. Go to arclight.com, like you look at the schedule, watch the committee meetings, you can send in letters, you can call, you can show up. I would encourage you to do so, and that's how our government works for the people, and it operates in the best way. So I would encourage you to do that if you haven't, and if you need somebody to show you around the Capitol, let us know. Like we're walking around there the same too. Our offices are there. We'd be happy to help facilitate that.
So piggybacking a little bit on what Representative Brown said, one of the things I had some legislators tell me is, Bo, you are the expert. I am not. I'm not a physical therapist. I don't know your field. I don't know what your patients are saying. And so that really resonated with me because all I'm doing is taking what my colleagues are saying are issues and what my patients are saying are issues and saying, I've got to have some fix here. I cannot afford this copay. Okay, let's figure out what we need to do. Let's go pass fair copay legislation, and we did. We took that issue to a legislator. That legislator said, yes, this is ridiculous. We've got to be able to fix this, and we did. So I would tell each one, every one of you guys, have the experience, same experience I had. You're the expert in your field. Listen to what you're saying, whether it be a colleague or someone you're working with, a client, a patient, whatever, and be able to. The representatives I've spoken to would love, just like you were saying, would love to be able to hear what's going on because they want to be able to help us. They want to be able to represent us. And that's what I found. I've been in committee meeting, listened to Representative Pilkington, that he was talking about the doulas and all that kind of stuff. I've been in those meetings fighting for bills that were important to me, but listening to all that, I was like, I need to be able to listen to some of these bills. It's really great stuff because we're all fighting for the same thing, which is improving the lives of Arkansas through better health care, better access, more affordable health care, accessible health care. That's what a lot of your healthcare practitioners want to be able to see. So.
Yeah, not just a ton to add. It's kind of the same question, right? But I'll say this, as obviously the newest member of the House, it was nice to know when senior funding was cut, they have to take my phone call, they have to answer my email, they have to get back to me with any issues. That's not hyperbole. So when Representative Pilkington and Representative Brown talk about that, reach out to us. I'm not a healthcare, I'm actually a lot like Representative Pilkington, I'm a hospital administrator, not a practitioner. I have a lot of baseline knowledge, but here I would say, you guys are the experts in health and wellness. Please reach out. Your representative has to get back to you. They will get back to you. They will find not only your knowledge useful, but also another representative like a Pilkington who is in the hospital administration, or a physician like Lee Johnson out of Greenwood, Arkansas, who has been a physician for a long time. We can work collaboratively on those issues and find a resolution for you. So please reach out to us. We're here to work for you. We're here to serve the people. That's why we do this. So I would just encourage you, always reach out.
Yeah, and I don't want to say everything that probably needed to be said was said, but just to reiterate, call your rep or one of us up here if you ever need anything, and we'll connect you with the right people. I've touched on a few of the issues that have impacted my life personally, and those are where my focus goes. But also when a constituent reaches out and say, hey, I've got this issue with my mom, or my cousin had this happen to him, those are the fuel for the fire, so to speak. I mean, I don't know there's a problem unless a constituent reaches out or I personally see it. So if you see something, reach out to a legislator, and like Pilkington mentioned, have a potential fix. Pointing out the problem is just one thing. It is so important that, like the fluoride issue, I'll just touch on that one. If anybody in here thinks fluoride shouldn't be in your drinking water, get involved. When that bill comes up, reach out to your legislator, tell them how you feel. If you do think it should be in your drinking water, do the same thing. But if when that comes up, reach out. Any type of legislation that is important to you, your representative needs to know how you would like them to vote, whether you agree with them or not. Something I'd also like to point out that healthcare is not as partisan as other politics. You'd be really surprised on how a Republican or a Democrat might vote on a certain bill. A lot of the legislation I had, we've got an 8-member Senate committee. There are 6 Republicans on there and 2 Democrats. A lot of the times when I passed what I consider good legislation, it was 3 Republicans and 2 Democrats. So it's a very bipartisan issue when it comes down to the monetary side of it or social issues. There could be some squabbling, but good healthcare policy on increasing access for patients, improving care, that's something both sides usually agree on, and there's a lot of common ground that can be found So another thing that wasn't mentioned, money. Are you, if you feel passionate about enough politics, write a check to the candidate that you think represents your beliefs. I mean, that's something I don't think a lot of people do, and that's why special interest groups win out a lot of the times. You know, there's a $50 tax credit in Arkansas. You can write your candidate a $50 check. If every constituent wrote their preferred candidate a check, the special interest groups would have zero power in this thing. But I mean, if somebody's writing you a $2,500 check, and then their PAC's writing you a check, and their other PAC's writing you a check, and that's the big voice in your ear, not the constituent. And that's sad, but you know, I'm notorious for bucking the big guys, and have done just fine answering to my constituents, and not worrying about special interests. But there's a lot of legislators that are scared of special interest groups, and if they know they've got support from their constituents, whether it's in committees, financially, or a voice on social media, those things will help put a backbone in your legislature.
Thank you all very much. I think that was a really good panel. And honestly, we have two people who are running against each other in this upcoming election. And I don't even think you would know it, because they were so focused on discussing potential solutions for this state. And so, I would like to commend Representative Holladay and Mr. Renshaw for that, and the rest of our panelists as well. Thank you very much for giving us